Hi, Dr. Saxena here, and this is something regarding the very wake-up call we are getting with this COVID-19. And somewhere we were not prepared when we talk about some things. This has raised some really disturbing questions about how this virus impacts our immune system, and we don't understand much for those who no longer test positive but don't seem to fully recover, and this are usually are they have some like chronic fatigue and all that for a very long time. And see, even the people much younger without any obvious health issues, they are finding it's very difficult to take up this particular stuff, and lot of man hours, lot of things are being lost. And I'd like to concentrate here mostly on the chronic effects of this COVID-19. I'm not talking about the acute measures. Acute, you get a illness, you are supposed to go to a hospital. If your stats, you are supposed to follow all the dictates what has been as prescribed. And if you have come out of that and your COVID is negative, and you still have some that kind of fatigue, something like feverishness, something like you have joint pains and all that, you have some bowel issues and all, I definitely would like you to understand this particular thing. We are talking about how to go ahead trying to decrease the this kind of chronic effects of this viral disease. What are the things which I have to look into is, I would like to see if the person is diabetic, or you have got obesity, or you have got a heart disease, you have got some cancer or autoimmune disease, or someone is having some alcohol kind of stuff. So so we need to know what is the person has got. I need to know the KYC of the person. If there are any of these things are there which underlying things which weaken the body's ability to fight the virus, number one. And see, I would definitely like to tell this particular stuff. When the historian, there was a person called John Barry, and he chronicled the Spanish flu in the Great Influenza, he stated that our immune systems were in better shape in 1918 than today. That Spanish flu, which came 1 century back, the people were not having all these problems which depresses or makes your immune system disbalanced. There are those at that time, they never had these pesticides, they never had this kind of radiation, they never had this kind of air pollution and all that, so that they were quite stable. So they were not exposed to many things in the past, so they don't develop the natural defenses. That was the kind of thing. So now when I know we have overused antibiotics to the point we now struggle with something called antibiotic resistance. And we now believe poor immunity is also associated with deficiencies of vitamins and minerals. You need to understand few things. One thing is, the immune system resides in our gut. A healthy gut also contributes to heart health, brain health, positive moods, healthy sleep, and obviously the ability to absorb nutrients in the food we eat. Until recently, humans ate mostly natural whole foods full of micronutrients that help maintain a healthy immune system. Today's standard diet, I don't have to be elaborate here. It's not a gut-friendly diet at all. The gut is bombarded with sugar, bombarded with prescription drugs, manufactured fats. Yes, that's called trans fats. Genetically modified foods, saturated fats. You got something like glyphosate and other toxic pesticides and additives in the processed food. This standard diet feeds back microbes in the gut. you have host of fungi which are not supposed to be there. You got some lot of anaerobic infections and all that. So what happens is many people find their digestive process in crisis. Some people have symptoms of gas, bloating, burping, constipation, diarrhea, irritable bowel. I want to focus on this microbiome, how this impacts your the food choices what you make impacts our microbiome. The empty our diet how and you need to understand how empty is our diet of micronutrients. You have vitamins and minerals. Research is finding that critically ill corona patients are deficient in micronutrients used by our immune system. In Spain, it was found that vitamin C levels were as low as undetectable in more than 90% of patients with coronavirus associated ARDS. We were talking in a think tank, and we feel that it is a good idea to measure how you measure your temperature, how you measure your blood glucose, how you measure your sodium, potassium and all that. And it's a good idea to measure the vitamin C which is present in the blood. So there is a Spanish study which showed giving high doses of vitamin D reduced the odds of ICU admission by 98%. Big takes. I can always go on. I somewhere believe that the micronutrients are zinc, you have got magnesium, you have got something like vitamin D, vitamin C, you have got some vitamin K. So these are the things which are going to help you in a big way. If your microbiome, if your immune system is in a order way, it is in a proper, it's not in a disarray, it's not kind of working. See, immune system, body works as an orchestra. One person also not properly putting the kind of beats and all that, it can make the whole orchestra into a kind of thing. So it has a systematic, and every immune system has to balance with all these particular stuffs. With this, I just want to tell you one thing, which I somewhere I've been talking about this particular stuff for a long time. A healthy immune system rules. See, going after the virus is only a short term, small and short term part of the picture, as the immune system is controlled by environment that exists around our bodies. That's a big picture. See, more than half of your body is not human. It comprises of a lot of viruses, it comprises a lot of bacteria, symbiotic bacteria, which is a good flora and all that. So more than half of it. So what is that? We are trying to work it out. So I somehow believe we need to look at, we cannot jeopardize our intestinal health. If we the second thing after the micronutrients and all that, I would like to add something like good probiotics, because this lactobacillus and bifidobacterium are decreased in COVID-19 patients, and it was I'm giving you the peer-reviewed journals reports. This was way back in February 2020. This was proved. Now we know there is one more thing which affects the microbiome, which is the RF electromagnetic field from the cell phones, which is disrupting the human skin microbiome. And there's another thing called blue light. Has a dark side. Blue light, whenever you are trying to read in the cell phone and trying to look at the cell phone, and in the night, there's a blue emission of light which exposure to causes a harmful effect on your health. Even that is also tries to jeopardize your melatonin levels, and by jeopardizing that melatonin levels, you are absolutely getting into some or the other problems. So The thing is, you suppress the melatonin and you change the circadian rhythm, which disrupts your REM sleep, which can induce some mitochondrial DNA damage, and it's basically induces inflammation in the body. The lesser the melatonin you are producing, the more the inflammation in the body. This is one thing which I can always tell you, which was Nobel Prize 2017 holders Jeffrey Hall, Michael Rauschbach, and Michael W. Young. They have shown that any mismatch in internal clock and external environment can cause disease. They were talking about the circadian rhythm, which is closely connected to the pineal gland as well as to the melatonin thing as such. So this is how the role of this environmental lighting and circadian disruption in cancer and other diseases. There were papers which are presented, and we need to understand that. Follow the kind of natural things. You need to have that 8 hour of sleep, and that too in the night, not in the morning. Let there be the natural light. Protect your eyes from blue light at night and red light at night. See what you can do. You can dim red lights for night lights. Red light has least power of circadian shift in circadian rhythm and suppress melatonin. Avoid looking into bright screens beginning 2 to 3 hours before bed. Expose yourselves to bright light during the day, which will boost your ability to sleep at night, as well as your mood and alertness during the daylight. With all this, I think these are the simple things which I can always try to make a note, and by following this particular steps, very simple methodologies, you are in a better shape to manage any, if at all you get any kind of infection, you can manage it easily. 98%, 95% of the population, when they can manage it without having any much problems and all that, I think everyone should try to work on this particular stuff, and improve your diet, try to work it out against, take off milk, take off kind of sugar and all that from the diet. Try to see that your microbiome is good. Don't take unnecessarily this one, particularly antibiotics is the one. There is a kind of pesticides, there is a kind of glyphosate in the food and all that. That is one thing. You try to develop, try to provide good yogurt, so that you can always have a good intestinal memory. Intestinal microbiome is one of the important things in building up your immunity. Try to focus on that. Try to see that you switch off your lights before when you go into the bed, and make sure you don't look into the bright lights. All these things will help you how you can deal with this particular problem. Thank you.